Good afternoon. Today's topic drugs for diarrhea. Dia means through, rhea means to flow or run. Diarrhea is the condition having three or more loose or watery stool in a 24 hours period. It's too frequent, poorly formed stool, passage of excess water in stool, decreased electrolyte water absorption, increased secretion by intestinal mucosa, increased luminal osmotic load, inflammations of mucosa, and exudation into lumen. The causes of chronic diarrheas are paracyclic infection, AIDS, colon cancer or other bowel tumors, endocrine or hormonal abnormalities, food allergy, IBD like Crohn's disease or ulcerative colitis, lactose intolerance, malabsorption syndrome, celiac or Whipple disease, others, alcohol, microscopic colitis, radiation, and surgery. Inflammatory bowel disease is a chronic relapsing inflammatory disease of the ileum, colon, or both. IBD is the term for two conditions, Crohn's disease and ulcerative colitis. Crohn's disease lesions are patchy, transmural, may involve any part of GIT from mouth to anus. Ulcerative colitis involves only the colon starting from the anal canal. Medication that causes diarrhea: anti-neoplastic agent, antiretroviral agent, colchicine, heavy metal, prostaglandin analogs like misoprostol. Okay. Next, what are the drugs using for diarrhea? Antimicrobial drug, non-specific antidiarrheal drug like absorbent or adsorbent, anti-secretory drug, and anti-motility drug. Probiotic drugs for inflammatory disease, they are using 5-ASA compound, glucocorticoids, and immunosuppressants. Antimicrobial drug is an agent that kills microorganisms or stop their growth. Microorganisms include bacteria, virus, protozoan, or fungi. Antimicrobial drugs are the chemical substance of natural or synthetic origin. Examples: norfloxacin, ciprofloxacin, rifaximin, cotrimoxazole, ampicillin, tetracycline, erythromycin, metronidazole. Probiotic significantly reduces antibiotic associated diarrhea, acute infection diarrhea, and risk travelers diarrhea. Probiotics are made up of good live bacteria or yeast that naturally live in our body. Constantly we have good and bad bacteria in our body. When we get an infection, there is more bad bacteria knowing our system out of balance. Good bacteria help to eliminate extra bad bacteria. Probiotic supplements are the way of add good bacteria in our body that helps keep our body healthy and working as well. And then probiotic examples are lactobacillus spp, lactobacillus acidophilus, lactobacillus plantarum, lactobacillus casei, bifidobacterium, bifidium, bacillus clausi, enterococcus spp, saccharomyces boulardii, streptococcus thermophilus, etc. Non-specific antidiarrheal drugs are first absorbent or adsorbent. Examples are ispagula, colloidal bulk forming agent. Next, methyl cellulose. Methyl cellulose, which absorb water and get swell. They modify the consistency and frequency of stool but do not reduce the water electrolyte loss. Both of them useful for constipation and diarrhea. Next, kaolin. Kaolin is a naturally occurring hydrated magnesium aluminum silicate. Pectin. Pectin stimulate epithelial growth in the colon, thus reducing diarrhea. It's naturally occurring substance, soluble gelatinous polysaccharides. Anti-secretory drug. Anti-secretory drugs are risperidone, bismuth subsalicylate, anticholinergic, and octreotide. Risperidone use acute secretory diarrhea. Bismuth subsalicylate, it inhibits Pg synthesis in the intestinal mucosa, thereby reducing CI secretions. Anticholinergic, antispasmodic, propanthelin, dicyclomin, mebivarin. are giving. Anti-motility drug. Anti-motility drugs are codeine, diphenoxylate, and loperamide. Diphenoxylate is synthetic opioid used exclusively as a constipating agent. Diarrheal action is most prominent because it's absorbed systemically and cross blood-brain barrier to CNS effect do occur. Loperamide, it inhibits the release of acetylcholine and prostaglandin, thereby reducing propulsive peristalsis and increasing intestinal transit time. Drugs for inflammatory bowel diseases are 5-ASA compound. 5-ASA compound examples are sulfasalazine, mesalazine, balsalicin, valsalicin. Sulfasalazine is a compound of 5-aminosalicylic acid with sulfapyridine linked through a bond. It's poorly absorbed from ileum. Mesalazine. Mesalazine reduced the production of prostaglandin, decreased inflammation in the colon, and the symptoms associated with ulcerative colitis. Drug interaction. Mesalazine enhances the gastric toxicity of glucocorticoids and hypoglycemic action of sulfonylureas. Balsalicin. This is 5-ASA linked to 4-aminobenzoyl beta-alanine as the carrier, which unlike sulfapyridine is inert. It can be used safer alternative to sulfasalazine. Olsalicin. Olsalicin consists of two molecules of 5-ASA coupled together by a bond. Glucocorticoids, prednisolone, enema, and hydrocortisone enema. Prednisolone highly effective in controlling symptoms. Hydrocortisone enema can be used topical treatment of proctitis and distal ulcerative colitis. Immunosuppressant examples are azathioprine, methotrexate, cyclosporin, TNF inhibitor, infliximab. Methotrexate anti-inflammatory property and immunosuppressant properties are there. Curd or yogurt is an abundant source of lactic acid producing organisms. Okay, it's good for digestion, stronger immunity, beautiful and healthy skin, reduce blood pressure, prevent vaginal infection, and good for bones. So add in your diet. Okay, curd, don't forget. Okay, see you next video. Bye.